Kyle. Well, about a month from today on September 14th, Riverside Park in La Crosse will be covered in pink. It's for the annual Stepping Out in Pink walk, which will be in full swing, and we thought we would take a moment this morning to talk about the focus behind Stepping Out in Pink, breast cancer. And joining us now from the Gunderson Center for Breast Care is Dr. Hope Guzzo. And good morning and welcome to Daybreak.
Morning, thank you for having me.
So, Dr. Guzzo, how prevalent is breast cancer here or nationwide?
Yeah, so breast cancer is the most common cancer diagnosed in women every year in the United States. There are between 250,000 and 300,000 new cases every year. So that equates to a lifetime risk of 1 in 8 for women in their lifetime of developing breast cancer.
And when you talk about risk, is family history a factor in that?
Yeah, it definitely is. So there are genes that can be passed down from one family member to another, which can increase a woman's risk of breast cancer. But even without the presence of a gene mutation, just by having a first-degree relative with breast cancer, it does increase a woman or a male's risk of having breast cancer. Along with family history, there are a number of other risk factors also for breast cancer, including breast density, lifetime exposure to estrogen, smoking, alcohol use, and also being overweight or obese, and in addition to physical inactivity.
I see. And what makes someone who is considered at high risk for breast cancer, and what can be done for those patients?
Yeah, so any woman who has a lifetime risk calculated to be greater than 20% is considered at high risk for breast cancer. So here at Gunderson, actually, with our screening mammograms now, your risk is calculated. And so any woman who has a calculated risk greater than 20% is typically referred to a high-risk breast clinic, which we have here at Gunderson. And then at that visit, we kind of review what are some factors that, lifestyle modifications that can be made, enhanced screening we discuss with MRI screening in addition to yearly mammograms. There are also some medications that can be given to help reduce your risk of breast cancer. And then in certain circumstances, there's even prophylactic surgery we can talk about to reduce risk.
Okay. And we mentioned Stepping Out in Pink. It's about a month away on September 14th. Why is that event significant, in your opinion, as a doctor in the Gunderson Center for Breast Care?
I think it's important for a lot of reasons. I think many women who are going through breast cancer at times can feel very alone and isolated, and I think this event is an amazing time for them to get together with other women and men who've been through this diagnosis and support each other and kind of celebrate for many women being on the other side of breast cancer and being survivors.
It is a good time for the community to get together and support each other. Well, Dr. Guzzo, that is all the time we have today. Thank you so much for joining us here on Daybreak.
Thanks for having me.